everybody, welcome back to Basically EMS, doing something a little bit different, a little fun today. We're going to be reacting to some Hollywood clips. So I'm Chris, I'm a paramedic. Who are you guys, so people know your backgrounds?
I'm Wade, I'm also a paramedic.
I'm Sami, I am not.
So you will be our best audience.
Yes. I'm a normal person.
You're a normal person. Well,
Stretch.
Debatable. Non-paramedic.
Yeah.
We'll go that far.
Yeah.
So, first clip we're going to watch, I think it's from Chicago Fire. So let's go ahead and jump right into it.
In here! Hurry! He's not breathing!
Always somebody running to meet you.
Wake up.
What happened?
We found him like this. He lives in the building.
Is that Pugsley Adams there?
Oh,
What's his name?
is
Jake.
Maybe Wednesday's in the next room.
maybe.
Jake? Lips are blue.
I mean, he's a little blue around the lip, yeah.
That looks pretty good, actually. I feel like the makeup there looks pretty good.
What is that?
That's what they look like.
Jake
Yeah,
showed
a
me
little
some
more.
opioid
Yeah.
overdose. This will reverse the effects. Are his parents home? I don't know. I'm on it. Which unit?
2B.
Is that I
Just in
am
the shoulder.
I am. When was the last time you did I am?
Paramedics.
Narcan?
Narcan. Never?
Paramedics?
Yeah. I know it's on the list of possibles, though.
And that worked real quick for an IM medication.
Cocaine?
It's a real party.
We got another one. Stay with them. I'll be right back.
Pugsley really let it go.
Where are these kids' parents?
Yeah.
I think they're children. Are they children?
Well, they said they were asking where the other kid's parent was, so
Oh.
another IM epi, or not IM epi, IM Narcan.
Paramedics? Anyone home? She's not
Slamming
responding.
a lot
Let's
in
give her
there,
another
too.
dose.
I'm gonna go explore the drug hells by
And are we
myself.
not supposed to do like CPR or anything?
Well, that would depend on if they have a heartbeat, which I don't think they actually
Oh.
checked on her, but
That last one, did she just inject near her elbow?
I think she was doing IV without an IV.
Hello?
Scene safety doesn't matter. We're
No.
just gonna go look by ourselves.
Yeah.
There's your CPR.
Okay.
Ooh, on the couch.
Yeah.
Really soft surface.
Uh-huh.
Really great.
Even normal Sammy knows that's not good.
Yeah.
There's Wednesday.
Yeah.
There she is.
No.
Ambulance 61 in May. We need 2 additional ambulances and a rescue unit to assist with forced entry, possible spinal injury.
Spinal injury?
Yeah. I actually don't.
Because she was on the ground?
I don't dislike that, and it's because you can't make the assumption, right?
Okay.
Like, was she standing and then had an overdose and then fell down?
I think that's a fair assessment.
Yeah.
You need to suspect it. Hard surface. She's on the ground. We don't know how she got there. We need to suspect possible trauma until we're proven otherwise.
Yep.
Oh.
Yeah.
Sammy, what do you think about all of that?
I thought it was great. I don't know why they're just in this random apartment, just like doing drugs together, I guess. I guess that's pretty normal, I guess, right? Does that happen?
Maybe they're in Chicago.
Do you see this
Yeah.
a lot? Drug den?
I don't know
with
that I see it a
children?
lot.
Yeah. Not like that.
I
Maybe
feel like-
certain parts of the area.
And I don't know. I feel like they were pretty young to all be like shooting up heroin together too.
Right.
if they're
Do we
supposed to
know
be,
it
like,
was
teenagers.
heroin? Did they say that?
Well, if it's an opiate, that's kind of a safe assumption. But
Okay.
because heroin's an opiate, like fentanyl would be an opiate. There's other stuff they could be taking.
It could be fentanyl, but based on probably when this was made, I doubt fentanyl was in
Okay.
the same.
At least not in the public consciousness
Right.
enough to have them right into the show.
Right. The first IM Narcan I thought was pretty interesting because
Uh-huh.
it gave a whole bunch, and usually if you give a whole bunch and you don't give them oxygen before, they do two things: they stand up, they puke, and they fight. And so he was pretty chill.
Well, and regardless, you should be giving oxygen. If somebody's not breathing, medications are really
Okay.
great, but really we should breathe for them.
So like a cannula? Is that what you guys call
Cannula,
it?
yeah. Look at you knowing the words.
But no, you're wrong.
Yeah, probably a non-rebreather.
So I mean,
Depending.
If it's an overdose, they probably have no ventilations on their own. They're not breathing.
Yeah.
So a nasal cannula gives oxygen, but it doesn't move it
Oh,
in and out of the body.
that's
So
fair.
we would need to ventilate like with a bag valve mask or something. For
Like
them.
a down the throat situation?
No, just holding it on
Oh,
their face
yeah.
and squeezing the air in.
Yeah, and maybe down the line we would intubate and and all
Okay.
that. But that's, I mean, first thing, just breathe for him and then give him not intramuscular Narcan. We now give it in the nose.
Yeah, that's all. That's the only thing I've ever seen Narcan as is like
Yeah,
the
the
squeezer thing in the nose.
yeah, and it's going to work significantly faster than into the muscle.
Okay.
So, and it's just easier. And do we want to have like open sharps where like there's people that maybe are upset because there's drugs involved and all that?
Okay.
We don't want needles open and all that. So we're typically not gonna do IM, and definitely not. So it looked like they were trying to give it IV.
Yeah.
But we don't just like take a syringe with a needle and like somebody like using drugs in their home. We're gonna start
Right.
an actual IV, like cannulate the vein, set up a bag, and all that stuff. We're not gonna just go straight into the vein like they did.
Yeah. Yeah, but she did that and then proceeded to start doing compressions anyway on a couch. So the patient's just bouncing back and forth between her hands and the couch.
Yeah, I mean it was movie CPR, right? So it was already like really shallow because it's probably on a real person. You don't want to actually hurt him, but like, I mean, there was a whole thing. When Michael Jackson died, they were grilled on like, did you do CPR on the bed or did you move him to a hard surface? Because CPR on a soft surface, it doesn't work.
Right.
You're just squeezing the couch. You're not actually pushing on the chest. So that would be totally ineffective.
Yeah.
And yeah, big issues with her just exploring the apartment where there's multiple overdoses by herself.
Right.
Like get PD involved. Like don't go into doors you don't know what's behind by yourself.
Yeah, that's scary.
Maybe
That's not
devil's
safe.
advocate, like I've never worked in a busy system like Chicago, so maybe they did call and they're just out or they're waiting for the next unit, but even then,
still,
like to
like-
go venturing off on your own into a
Yeah.
dark home is never a wise
No,
move.
yeah.
Especially where there's lots of drugs very clearly.
Yes. Yeah. Yeah, if it was just like grandma's house, like, and you know, they were looking for medications in the medicine cabinet, different story. But like
Right.
drug house, maybe don't go.
Yeah.
Yeah.
Not a safe game.
None of that.
No.
All right. You guys ready for the next one?
Think so.
Yeah.
All right, let's hit video 2. Yeah, up next we have Dr. Kamealoha from the Disney Channel. So I think this is supposed to be like Doogie Howser for the modern world.
Yeah.
Modern kids.
Excuse me. Hey.
PD really did a good job of holding her back.
Yes.
Is
Let me
this
see him.
a child?
It's a child. It's
She's a child?
doctor. She's a child.
She's a child doctor.
Excuse me. Kid.
Oh, what she got?
Possible concussion.
Come on.
Get off me.
We can
Going to
definitely tell
jail.
You'll be
concussions
going to
from
jail for criminal
looking at their
negligence.
face. Oh, get your hands off her. She has a card.
Of the hip and he's gonna lose his leg
He's
unless
not
I
wearing
fix
socks.
it right away. Hold his hips down so I can rotate his leg.
What?
There's no palpable pulse in his leg and he's gonna lose it because of blocked circulation.
Oh, I'm not gonna.
Hold him down now. And you, support his neck.
That's a strong
Do
Do
independent
none
woman.
of these men know anything about
Hold him
like
steady,
saving
okay?
lives?
They're cops.
Here we go.
So
God.
they're not medical.
Ugh.
Such a risky business.
Oh yeah. Oh yeah.
I can feel pulses, circulation.
I mean,
is
she had
restored.
her
I've
fingers in
done
the right
some
spot to
practice.
help him,
Yes,
though.
doctor.
Yeah.
Go. And something we can use to put pressure on this wound to stop the bleeding.
What bleeding?
Obviously the bleeding. Obviously her scrunchy.
Please don't tourniquet bleeding like that. Especially
Hell
not like
yeah.
Scrunchy.
not over the elbow.
Yeah.
My daughter.
But the scrunchie and the pen light would work. I mean
Yeah.
that's it's a little thinner than you would wanna do, but it would work.
Like a pseudo windlass there.
Yeah, using the pen light as a windlass. And
That's the
scrunchie.
stick that you twist to tighten the tourniquets down.
Okay. Okay.
Yeah, it's kind of how you get that pressure around.
Yeah.
Yeah, I don't know what bleeding she was supposed to be stopping. It's like
Yeah.
a kid show, I think. So I get they're not gonna be, but I was just like that was an abrasion that like we would like throw some couple 4x4s on and just be like, you're good.
And so what's a 4x4?
A 4x4
square.
piece of gauze, like 4 inch by
Oh.
4 inch.
You're just gonna put gauze on it?
Yeah.
Call it good?
Yeah.
It's
It
not
wasn't
supposed to be there.
actively like pumping blood out, so tourniquet might have been a bit
Too
of
much.
overkill.
Yeah,
Yeah.
yeah. Tourniquets are for like arterial squirting bleeding, not for like you know, what would happen if you know my kid tried to do a wheelie on his bicycle and fell off, right?
I think it was a little bit more intense than that.
Well, that's my next question. So, what was the mechanism? Because twisting the hip like that, if they had a pelvic fracture, you're running the risk of pinching arteries, veins, nerves on that
Well,
rotation.
and
too.
I think she said that he had a a fractured dislocated hip, I think is what she said. We were kind of talking over the audio, but
I just got the knee situation.
no, it was the hip that was the issue.
Ugh.
Which fractured and dislocated at the same time, I guess is possible, but
Yeah.
especially with a hip, that's not going to happen. And like, do you have X-ray eyes? How did you know what was going on internally? We can't just look at that and know.
She touched his leg. She felt it.
I guess if you're a 12-year-old doctor, you're just that good.
Exactly.
You know,
She's a
Carrying your pen
prodigy.
light.
Yeah.
Ricky rescue.
yeah, and you know, the dude's hurt, and she just runs up and like, nobody stops her.
Yeah.
And then she just proceeds to start barking orders at these like
Cops.
grown men cops, and they're just like, "Yes, ma'am." You know.
Okay.
I mean, I hear Hawaii is pretty chill, so
Yeah.
maybe.
And then
that's
is her
true.
dad a real doctor? Is she a real doctor? What's this card she whipped out?
it was her medical license as a doctor.
Okay, so she's not a child. Or is
She is a child
She is
and
a-
a doctor.
Yeah.
Okay,
So
got it.
Doogie Howser MD was an old show where Neil Patrick Harris played like a kid that was a doctor at like 13,
Oh.
but he was like in a hospital saving lives.
She's
And
just
so-
out. She's out in the field.
As
She's
far,
working.
the extent of my knowledge of the show is this one clip, and she was out doing it, man. She was out saving lives.
I think she was
Got
taking
it.
her driving test. Yeah.
Oh, really?
I think that's what it was. Yeah.
Did she hit him?
No, I know. Maybe.
Did she cause this accident?
She like the guy was like, you fit well. Actually, you saved the life, so
Exactly,
we'll give you
you
this
passed.
one.
Yeah.
Well, you're not a good driver, but you are a good lifesaver. So
Yeah.
check that box.
Yeah.
Yeah, I mean, I don't know. It's dramatic, like, but we would never know, and we're not going to try to reduce a hip fracture. Like,
No.
the actual mechanism and force to reduce a hip fracture, like, you know, you got football linebackers pushing on hips to get them back. It's not an easy thing, and sometimes it just has to even be a surgical procedure to get those hips back. So you're not just
You
like
can't just like move their leg.
not like that.
Well, and then
No.
she said if she did say fractured and dislocated, then she's just twisting broken bone around too. X-ray confirmation for sure needed.
Which, to be fair, typically protocol will allow if you have absent distal pulses to move the limb
okay.
into anatomical position. So that's not necessarily wrong, but there was a whole lot of magic assumptions made as far as what injuries were going on. Also, like pen light to the eyes. Oh, he's got a concussion.
And you can't. That's not how you check for concussions.
No, so by definition, a concussion is a closed head injury, like a brain injury, with
Okay.
nothing that shows up on like a CT scan or anything. So
Oh.
you can't diagnose it.
You
Like they're
can't diagnose a concussion.
not like that. I mean,
Okay.
there's signs and symptoms that we can diagnose, right? Like
Okay.
loss of memory, like short-term memory loss, or loss of consciousness.
Repeated
you know.
questioning is usually one. That's why they
Yeah.
ask
Okay.
you like memory questions when you get a concussion.
Okay.
Yeah. Nausea, vomiting's a common one, maybe some visual disturbances, but like all that could be that, or it could be like a contusion on the brain or something more significant that we need to go and actually find and scan the head. And so we can't just say it's a concussion. He could have concussion-like symptoms.
Right.
But looking at the eyes, if I'm seeing something abnormal about the eyes, it's beyond a concussion symptom. That's
Yeah.
like head bleeding.
Their brain is bleeding into their head at that point.
Yeah. But we didn't get through medical school at 13, so
That's true.
What do we
She
know?
is better than
we
you.
don't know. We don't know much.
I do have my driver's license though.
Well, I'm sure she did after this episode.
We'll see.
She'll get the form signed by the cops, so she's good. She'll just tell them to
Yeah.
sign it.
My favorite part was the cops were just kind of like, "Hey,
No,
What's up?
stop.
You know, yeah, they're just they don't know.
they're
Yeah.
just
So-
doing
somebody's
their
telling them what to
job."
do.
Yep.
All right, let's hit the next one.
Only. It's your own
911
fault,
Lone
you
Star.
know.
911
Not that he
Lone
dumped
Star.
you. He's an
Rob
idiot.
Lowe.
But that you caught feelings and kept it going.
She caught feelings.
You broke our rule.
Who wouldn't with Rob Lowe?
Got attacked.
To be fair.
So I'm sorry if you got dumped and all, but I hope it stings.
And I hope you freeze to death.
Foreshadowing.
She's as cold as ice.
911, what's your emergency?
I think my husband froze to death.
I was out on a run
no.
and I got back. He was still in
She
there.
called it though.
Pretty sus.
I think he's
Hello.
Okay, hold your let's try to get him out. Hey, Brad? Brad, you with us? Brad?
How long
Come on,
has he
Brett.
been in there?
Oh my
At least
gosh.
45 minutes.
It's frozen solid, Cap.
Yeah, I tried melting it with the hairdryer, but no use.
Okay, Halligan.
Yeah, that would work.
Yep, flying in.
I mean, it worked in my freezer.
Turn it off.
I unplugged
Oh
it.
yeah.
Yeah.
There's not an automatic off switch?
There is, but Brett disabled it because he knew better.
All right, what's the ETA on
Obviously.
medical?
Men,
Five
right?
or less?
You seriously?
They're not dead till the warming dead, right?
All right, let's try to get him on the floor. Get some warming blankets.
Active rewarming would actually be pretty harmful for this guy.
Yeah.
Is it possible to like fully
Fred?
freeze to death like this?
Sure.
No pulse.
You think he was just standing there and he was like, yeah.
Starting
definitely not
compressions?
Cap, medical's here.
Nancy, TK?
Rob's pretty strong.
He is.
Oh, we got to double check.
Yeah.
Just double check.
He's probably fine. Let's double check it.
Nope.
I like that she looks at him like, nope. Yeah,
Are
like
you putting off
we didn't know that
Dang.
already. We didn't
Yeah.
realize that already.
Got attached.
Oh my
So
gosh.
thoughts, yeah. I want to hear your thoughts on this, Sammy.
Well, first of all, I just can't really imagine standing there and allowing myself to freeze to death. Second of all,
Yeah.
I can't. The chest caving in was just a little bit intense for me. Have you guys experienced anything like that before?
I have actually no. I've never caved somebody's chest in while
Oh
they're in
my
CPR.
gosh.
I mean, not like that.
Yeah.
Usually when you do CPR, you kind of leave them a little mushy.
Dude, I want a freezer that strong that can freeze that much body mass in 45 minutes to that level of cold.
Yeah.
Right? Like somebody's like, where is that technology?
Right. And there's like, they froze everything, but there's no frostbite signs.
Yeah.
There's no nothing.
Well, and his whole shoulders and head were outside of the unit, but those
Right.
are still frozen.
Right. Yeah.
That's what I'm saying. You're telling me he just stood there while this happened to him.
Well, he's supposed to be getting cold, Sammy.
And maybe his arm was injured and he wasn't able to open the door. I feel like maybe there's more to it that because I did watch the backstory.
Okay.
She was hooking up with. It sounds like open relationship.
Okay.
She and Rob Lowe were doing the
Her
deed.
and Rob Lowe for real?
Uh-huh. No, not in real life.
Oh, no, I mean like in the show.
In the show.
Obviously.
Yeah, and then she caught feelings for him, and that was the earlier discussion why they were fighting.
Okay.
And so
then-
Rob murdered her husband.
No, she murdered her husband.
He was probably going to come back from that freezing until they crushed his empty chest. Like there's just nothing inside of it.
Hollow.
Yeah.
Yeah.
As chests are, I think, anatomically.
Hollow?
Yeah, I think chests are hollow. Can you confirm that?
Are you talking to me?
Yeah, you. Yeah.
I can neither conform nor deny.
If only we had somebody that would know if there were things in the chest.
Yeah. I mean, there's a couple things here and
Yeah.
there that I can think of top of my head.
Yeah.
Oh.
Like your heart and your lungs.
Right,
you know?
right.
Oh, those things. Yeah.
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 That's what CPR's for. Turns out.
Right.
Not on frozen bodies.
Yeah.
We learned that.
Yeah.
We learned. Hopefully, we need to add that to our EMT curriculum. That when they're frozen solid,
Yeah, be careful.
don't crunch their body.
Yeah. Don't drop them either. Could you imagine what would have happened?
Uh huh.
Like a statue.
He was like kind of squishy when they were first touching him out of the cryo chamber. So a little bit of a continue.
I don't know. They turned him like a statue, which I like how
Yeah.
how easily one of the guys just turned like a full grown man. Like it was just like he weighed 20 pounds. Just turned him around.
Maybe
and
that's
laid
what
down.
happens when you freeze to death. Have you ever like picked up somebody that was frozen to death?
Not
Maybe
like
you
that.
lose all body mass.
Actually, yes.
Oh.
Yeah.
Oh.
I've been on cold exposure froze to death patients.
Oh.
And they were still they still weighed about the same. So
Okay, great.
But he was pretty rigid like a statue, so maybe they're just pivoting on the heels, you know?
I mean, they could have, but I still feel like it would be a little harder than that.
yeah.
But now we're really getting caught up in the minutia that doesn't matter.
Yeah.
What does matter is her pulling out a stethoscope. Was she listening to lung sounds? Like, what was she going to use that for?
Listening for heart tones and she can see it, you know?
Yeah, that was a little crazy.
Yeah, or like, is she listening for like the carotid? What is breast? I don't know.
Yeah, he was a goner. He was definitely a goner.
I think so. Yeah. Don't turn off the safety,
Features,
safety
yeah.
features on your cryogenic chamber.
They're
thing.
there for a reason.
But you know, men are too smart, right?
Yeah, we know better.
Yeah, yeah. It's
Especially
true.
rich men.
Especially rich.
I
men.
bet that bad boy went cheap either. Just thinking about that
No.
cryo chamber there.
No, no, and you know, I wonder if he got it just for his shoulder injury too. So you know, like it's just a mess. That whole thing was a mess, and the infidelity behind it.
Okay, well, they were in an open relationship, Chris. It's not
But she
infidelity.
caught feelings, which was against the rules.
It's Rob Lowe.
He said
Can't-
that.
Yeah, how can you not catch feelings?
That's
for
true.
The Rob Lowe.
That's true. Did you catch feelings even watching him put his hands through another man's chest?
Yeah.
Yeah.
I thought this is what my exact thought was. Wow, how strong is Rob Lowe?
Fair. Yeah, I don't feel like there's much more to talk about that one.
Yeah, that one's pretty clear cut. Call it.
Unless Sammy wants to continue to talk more about Rob Lowe.
No, I'm good.
No, you're
Actually,
good.
I did start watching The Floor, which is a Rob Lowe show. So.
It is. We my children love it. It's a good show. Yeah.
Love him.
Should check it out. Cool. Yeah, I think it's pretty fun. Get a little perspective. Did you learn anything today, Sammy?
I learned that the chest is not hollow.
That's good. That's fair. That's fair. I also learned that. Thanks, Wade.
Yeah,
Thanks,
you're
Wade.
welcome.
Yeah. Any other big takeaways from the non-medical Sammy over here?
These shows are probably not accurate. That's my takeaway.
So the blue lips in the first one was pretty good. That's pretty.
That's like a real thing that happens.
Yeah, when they have low oxygen, their lips turn blue.
Some stuff was actually pretty. Some stuff was pretty real, and some stuff was way off base, which is going to be how it is, right? But you know, some of it was really, really over the top, which
Yeah.
is the fun stuff to watch.
Yeah.
Yeah. How about you, Wade? Any closing thoughts?
Don't get into a cryo chamber. And then also, definitely, if you're going to be a provider that's going to be giving Narcan, don't IV straight into their veins, like with the med.
Yeah.
You know.
Yeah. I don't know that anybody's done that in the last 50 years or something. Yeah.
Yeah.
It's not what we do anymore.
I get like MacGyver medicine, but that's a step.
Well, MacGyver doesn't have tools. They are paramedics with tools. Use your tools.
Truth.
So
Truth.
different story.
That's a good slogan.
Use your tools.
Yeah.
Right on. Yeah. We'll have Sabrina edit over like use your tools.
Yeah, I like that.
on the video. So holding you to that, Sabrina. Yeah. If you don't see it on this video, comment mean things to Sabrina
Yeah.
for not doing it, please,
Yeah.
because she's gonna edit this.
I'm
one.
thinking like SpongeBob with the rainbow.
Imagination.
Use your tool.
All right. With that, thanks for watching. We'll definitely do more of these kind of things in the future. This is what we're excited about getting to do, not just the podcast, but having some fun with some EMS stuff as well. If you've got suggestions for good clips that you would like us to go and watch and react to, please leave comments. You know, we're only a couple people that haven't seen everything, so lay it out there so we can go try to check it out. Keep an eye out for more fun videos. Thanks to Wade and Sammy for being here.
You're so welcome.
I live here.
Thanks for having me.
Yeah, Wade lives here. Also, Wade, fire jacket today. Just got to mention it.
Yeah, it's pretty good.
Yeah, it's pretty sweet.
Pretty loud. But yeah, we'll see everybody next time. Thanks.
Bye. What the heck is that?